Hi, I'm Matt Ford with DETV News, and tonight we're bringing you a special report on food insecurity here in the First State. With rising grocery prices, ongoing economic pressure, and recent cuts to the federal food assistance programs, more families than ever are turning to food pantries for support. At the center of the response is the Food Bank of Delaware, working daily to fill the gap, even as resources become more limited. But the growing need comes with questions, such as how is the food bank adapting to these federal cuts? Are donations and funding being used effectively? And what's really being done to ensure no Delawarean goes to bed hungry? Joining me now for a candid conversation is Cathy Kanefsky. She's the president and CEO of the Food Bank of Delaware. Welcome, Cathy. Thanks for joining us.
Thank you, Matt.
I appreciate you having here. So, Cathy, let's jump right into it. For those who may not know, can you sort of set the stage and give a quick overview of the mission of the Food Bank of Delaware and how widespread the need is for our state right now?
Absolutely, and we welcome this conversation. I know there are a lot of questions out there. Quite simply, the Food Bank of Delaware, our mission is to ensure that no Delawarean goes hungry, and we work tirelessly to make sure that the 1 in 8 Delawareans who are now food insecure, including 1 in 5 children, have enough food to thrive, not just survive, but to thrive. And we are, we've always been in a position where we have to continue to figure it out. You know, curveball comes and we figure it out, and you can go through history and see what that all looks like. But these latest rounds of curveballs have kind of thrown the whole country for a loop, and certainly food banks are feeling it more than ever.
So you have said before in other interviews that no one expects themselves to be food insecure, right? No one wakes up and have that to be their goal, right? To be food insecure, not be able to feed their families, put food on the table. But what have you seen recently in terms of those seeking help? Are you seeing new faces?
Absolutely, and thank you for saying that, because that is something that, you know, I have started to say, and it seems a little bit like, why wouldn't somebody realize that? But when you're 5 years old, and you're asked what do you want to be when you grow up, you're not having anybody say food insecure. But the other thing you're not hearing is, I'd love to work at a food bank. So what we do is not even on that career path for most people. We fall into this work because we're passionate and we're servant leaders and we want to see the world be better. So the fact that we are in this work, it's a pleasure to be, and an honor to be able to wake up in the morning and have something to do and have somewhere to go that we know is needed right now and makes a difference. But we, to answer your question about who we're seeing, I've been in my role just a little shy of 4 years. So I came I don't know if we're ever out of the pandemic, but as we were kind of coming out of the height of the COVID pandemic, so people that we were seeing then were the folks that had lost their job, they had lost a loved one, they had their life turned upside down, and they needed help from the food bank for a variety of reasons. We saw our food distribution double in that time from what we were doing before COVID hit to then, and what we're seeing now are those same numbers, but a different makeup of the numbers. So now we have people coming to us who are working 2 and 3 jobs, and they still can't make ends meet. And I think what people don't realize is that as the cost of everything has gone up, including food, but everything else, the cost for us to be able to meet that need has gone up for us as well. And I think sometimes people think food banks have a magic wand, because that's what we want people to think that need us. We want them to think, yeah, we got you.
Go there.
Right?
Right. So I want to get into these USDA cuts that we're seeing, not just here in Delaware, but nationwide, right?
Yep.
So the United States Department of Agriculture, also known as USDA, they've halted shipments that make up for more than half of the food bank, of what the food bank receives. What has the immediate impact been for your organization and the people that you serve?
So the last couple of years, we have been, stretching every dollar to do the work that we need to do. We count on certain solid, sources that we know that are coming to us. We've long enjoyed a really strong partnership with USDA, and USDA makes up more than half of our food in the course of a year. What these recent cuts were 19 truckloads that are not necessarily trucks parked on the side of the road that just are not coming to us now. It's a visual that people kind of in their mind see, but what it means is that the orders that were going to be going into those 19 trucks from April through the end of June were canceled. And when we first heard about it, the word was halted. They weren't canceled, and it's an interesting learning for anybody who's really interested to know more about it. There are 4 different stages of that USDA product: when it gets ordered, and then when it's approved, and then it's coming to us, and then it's not, or is. And I think what hit us really hard was we weren't prepared for that. It happened overnight. All of a sudden we heard that's not coming. And then the next day, it truly was canceled, and not just the 14 that we originally heard about, but 19, which took that to 900 million meals that were supposed to come to us. 900,000.
900,000. Yeah. What kind of strain does not being able to count on that 900,000 meals place on your team, your organization, your clients?
As I said, it was food that we were counting on. So what we had to do, and a lot of people quickly go to, the cost of that. The cost to replace that food is one element. Everything else, like you just said, is the rest. So it's not just the food bank proper. The food bank works with 200 partners throughout the state, agency partners who get that food as well. So to have that kind of food canceled includes protein and eggs and milk and all kinds of foods that were expected to be going into our pantries, and not having it go means that we have to make up that difference somehow. And that difference is being made up, quite honestly, partially, not fully, but partially because of the outpouring of really, truly a groundswell of community support.
So Cathy, I want to talk about these USDA cuts that we're hearing, not just in Delaware, but nationwide, right? So the United States Department of Agriculture, also known as USDA, has halted shipments that make up for more than half of the food that the food bank receives. What has the immediate impact been on your organization and the people that you serve daily?
Absolutely, and thank you for asking that question the way you just did and using the word halted, because words matter right now, and this has been a learning experience for me. I didn't know all the nuances of how USDA food gets to us from the point of it being ordered. So you're absolutely right. More than half of the food that we receive to distribute throughout the year is USDA product and comes to us from USDA. What this latest cancellation? So honestly, it was halted until they were canceled, and canceled meant no hope. They're not coming. 19 truckloads of food that had been in the process that were the way we look at things, ordered for us to receive. So that turns into 900,000 meals in those 19 trucks, and it includes everything from produce to protein to dairy. It was a lot of the food that people need, and for us not to get it is one thing. For us not to have a little bit of a heads up, because we're planners and we use every dollar to do what we need to do in this state. And so having that many meals not come to us, that much food not come to us, and not have a heads up until the day before the decision was made, it puts us in it puts us in a crunch.
So without having these 900,000 meals, Cathy, are there changes in income requirements because you're seeing an influx in folks that need it?
There's not a change. We do, and you can go on our website and you can see for our different programs what that income requirement is. We do ask people to self-declare. We don't ask them to bring their finances and have somebody that looks through everything, because quite honestly, we want people to feel like they can come to us. You have to be a Delaware resident, so we ask you to bring a proof of residency, and we sit with, when somebody comes into our food pantry and sits with us, we go through all of that with them. When somebody signs up to go to one of our other pantries, our mobile pantries, our mass food distributions, they have to self-declare their income too. So we are looking for people who really truly need us. And again, I don't know how anyone would think somebody chooses to get their food from a food bank as their primary way of getting food.
So I want to go broader with these USDA cuts, if I may. So some of these funds also supported local farmers, and we have a lot of farmers in Kent and Sussex County here in Delaware, right? So how can you say these cuts are impacting the broader food ecosystem here in Delaware? So not just pantries, but we're talking agriculture, health outcomes, and local jobs.
Sure. So just like our fantastic partnership with USDA, we have a fantastic partnership with our farmers, with our Department of Agriculture, and the farmers throughout the state are where those orders that got canceled were placed. So the ripple effect for the farmers that are growing produce and looking to sell it, one of their main places they sell to is USDA, and one of the main reasons they do that is so that we get that produce to give out in the community. So it's a source of income for them to not be able to get that, and we're concerned about that.
Speaking of concerns, I want to move to Dover now, where you've called on local and state leaders to step up where federal support has been pulled back or halted. What's your message to those in Dover? What have you said to them? What are you hearing? And have you seen any promising actions or commitments yet from our leaders in Dover?
You know what? I will start with the last one, and that is yes. And I feel very fortunate to live in this state. We are truly a state of neighbors, and I know a lot of people say that in other states, and maybe they have the same thing. But we can walk into Legislative Hall, and seriously hug, high five, whatever it is, stop and chat with our legislators and our elected officials, and we know them and they know us. So when this happened, I can tell you that I was on the phone pretty much constantly with not just our elected officials here in Delaware, but also our United States Congresswoman and our two state senators, United States senators. They have been fantastically supportive. Tangibly, a couple of them have hosted food drives. So interestingly, we don't typically set up camp at the food bank and have people coming and driving through those lines bringing us food. If you're on social media at all, you can see those two events that we had that were hosted by in Newark and in Milford, hosted by local state legislators who made it a point to say, we need to help, and we had cars lined up half an hour before we were ready for them, bringing food, not lined up a half an hour before we were ready for them to get food. And it's a shift in the dynamic that's beautiful to see. And quite honestly, we're asking for funding. I mean, we ask for funding every year because we're a nonprofit that relies on that kind of funding. Right. We get funding from a lot of different sources. The state government, federal government are two of those very significant sources. And so we are now in conversations with our elected officials, with the governor's office, because we need more help right now, and we are part of the state's infrastructure. I say this a lot. My whole career has been nonprofit, and if I haven't been in a leadership role like a CEO or an executive director, my main role was development. So I know what it's like to fundraise for a charity. And the food bank is a little bit different. We are not just a charity that's looking, not that's a problem with a charity that's just looking to do good things. We're a charity that's meaning life and death for people.
Right. Very true. So I want to ask, what are some of your most urgent needs right now with the food bank? For example, are you prioritizing certain types of donations or prioritizing certain types of support right now?
Yeah. The two main ways we get support are the two main ways we always have. So it's either product or it's money. And so we rely on food donations, and I've been saying this more than I ever have in the last couple of weeks. That means the second grader who's doing a little food drive in our neighborhood, or it means the person that's willing to write us $1 million check, because no donation is too small and no donation is too large. But we do need food. Absolutely, and we have a list on our website, and we can run through that, the types of food that are the most desirable. But we also need funding in a different way right now. If we don't get that donated product that we need, we have to buy it. And if you walk through and anybody that's interested in learning more, I invite you to walk through our warehouse with me.
I've been there, it's incredible.
And I've probably shown you the hang tags that
sure
hang
have.
on, if you're looking at the food that we have, there are 3 different hang tags. One is USDA, one says DON, which is donated, and the other is PUR, and that means purchased. And those hang tags represent the food that we had to purchase because we don't have in a different way. And going back to what I said earlier, we're purchasing at that higher price too. So the more that we don't get donated, we have to purchase, and the more that we purchase is we need more money.
So I want to move now to a term that a lot of us have seen in the local media, and that's food is medicine. So Lutheran Community Services and Christiana Care have partnered on the Delaware Food Pharmacy Program, and that's pharmacy with an F. So what's your view on food is medicine approach, and how can food banks like ours here in Delaware support long-term health outcomes?
Sure, that is an incredibly popular initiative right now for good reason. I just came back from a couple of days at a Feeding America conference in Atlanta, and my colleagues from across the country, that was one of the main sessions that we all took part in, because it is huge, and it ties back to the very basic. It's not, when someone's food insecure and they don't have anything to put on their table and they have this much money, they're going to buy the food that much money buys, and typically that's not the most nutritious food. So we are always pushing the most healthy, nutritious food that we can possibly provide people. Food as medicine takes it a step further, because there are sometimes we see people getting discharged from the hospital with diabetes, and they need a special diet to be able to maintain their health. And so those areas in the food as medicine, that's what's kind of taking off right now. We at the food bank have been really humbled to be able to play a part in the state, that we're truly turning this into a major initiative for our food bank. We're neutral. We're not a hospital, and we have a lot of healthcare entities, a lot of hospitals throughout the state that are all doing some kind of something in this space. Sure. So we've done it. We've had our second round table, and we bring everybody together to say, if we're going to do this really meaningfully, and we're going to do it in a way that makes sense, and we're going to do it in a way that's sustainable, which means funding, how can we do this together? And so I'm serious when I say every health entity was represented, and you don't see that often. And we were all there because we're trying to figure out how to do this better. For us, that means and I hate to keep coming back to funding, but it's what it is. We have been reactive. So we partner with a lot of our hospitals, and at discharge, one of the questions is, are you food insecure? And if somebody checks that box, what they've been doing is coming to the food bank to say, oh, can they get food? We say, sure, but up until recently, there's not been a funding mechanism to support that. So I am all about food as medicine, and we are thrilled to actually be making it making a concerted effort at our board level, and then working directly with the state to make sure that we're doing this the best way we can, sustainably.
So, Cathy, with the rising food prices and strained supply chains, as we know, how is the Food Bank of Delaware working to ensure that clients still have access to that fresh, nutritious options rather than just, as we just talked about, those shelf-stable items that maybe aren't as nutritious?
So, a couple different ways. We, as I mentioned, we have 200 partners. LACC is one of them, who we really purposefully take a back seat. I don't think there are a lot of people that realize that the food bank is behind a lot of the food that are in those pantries throughout the state. That's okay, because if somebody's going to their church, to a food closet, they trust that church. They might not want to think that it's the food bank that they're going to. So we're okay with that. But a lot of our fresh fruit and fresh produce and proteins are going if they have the capacity to store it. We also have 2 on-site healthy pantry centers now at both of our locations in Newark and in Milford, and we've moved to a choice model, which means they come in with a grocery cart, we pair them with a volunteer, and they go up and down the aisles and they pick the food that they like and they want, instead of us deciding they're hungry, they're going to eat the food that we've decided that they want and they need. And it's just flipped the perspective for us in kind of just being able to provide that respect and dignity for folks. but it's also for the people coming to us, they feel heard, they feel valued. And I actually overheard an older couple refer, I said, what are you here for? And they said they were going grocery shopping. And for me, I got in my car and I might have cried a little bit that day, because that was success for me. For somebody to feel like they're coming to the food bank and they're going grocery shopping, they're not coming for a handout. It's just, we're all about dignity and respect, and as servant leaders, I don't know how we could do it any differently.
Dignity, I think, is the perfect word to wrap that up. So I have to go into some tough questions. You know, we see a lot of on social media and also traditional media, you know, there's naysayers. They say, what's really going on there? So part of the reason that we asked you here today, Cathy, is to maybe, you know, give the truth about what's happening to some of these, you know, misinformation and disinformation that may be out there on the internet. So I'm going to ask you some of these questions, if that's okay. So there is a perception out there in the media, social media, that some people may be, quote, working the system. And we hear that with a lot of social services, worried about working the system. Showing up at food pantries when they already have steady incomes or maybe receiving food stamps. What do you say to people that feel that the system is being taken advantage of?
I ask people to put themselves in somebody else's shoes. I cannot speak for 100% of the people that come to us, but I would welcome anybody who has that thought to come stand with me in our Healthy Pantry Center for an hour and watch who comes in. And yes, do some people drive a nice car? Yeah. I've also had somebody tell me that's the only thing that they have, that they have payments left on that car and then it's theirs and they don't have anything else to their name. So we have people from all walks of life, and I've been blessed to have a mentality that I don't judge. And I just think that we have people that that find themselves in a spot that they never expected. We're here for them, and again use with dignity and respect. But a very good friend said to me once, when I was actually talking about whether or not I wanted to even apply for this job, he said, you know, why wouldn't you? And I said, I've never been food insecure. And he said, do me a favor and take the word food away from food insecurity, and you tell me when you knew what the next day was going to bring. And I think that's my message to anybody who wants to judge the people that are coming to the food bank. I pray that they never find themselves in a situation that others find themselves in, but if they do, we'll be there for them.
My next question here, how does your organization, the Food Bank of Delaware, ensure accountability and integrity in who receives food assistance? Are there checks and balances in place to remove any abuse or prevent abuse?
Yes, and we've made quite a few changes in the last couple of years. Coming out of the pandemic, I don't want to say we lightened the kind of restrictions, but we just had so many people needing us. So, and we also had a lot of support. So we didn't have to necessarily make sure that we had enough food next week to continue to meet that need. We're not there anymore. So we've made people. It's supplemental. Our food should be supplemental to the folks that need food. They can come once a month, and we do have checks and balances. And we now have we track electronically. So when somebody comes in, we're tracking them. If they come back 2 weeks later, we say, I'm sorry, you've been here this month. So we track income. Like I said, it's self-declared, but we track how many times somebody's coming, and they're not beating the system if they, I should say, by coming to one center and then going to another and going to we track them all the way through.
Okay. So, again, on that same vein, do you worry that stories in the media of people gaming the system could discourage others from donating product or supporting financially your mission? I
do worry about that, because there are people that have some significant visibility that are making some of these claims, and we try not to get into a fighting match. Nobody wins when you do that. I do if I know the person or I know how to get to that person, I'll pick up the phone and call and say, hey, can I explain what you just did on social media, can I explain to you what you asked and how that was a little bit off? Because that's what's been happening. And I think there are some people out there that just don't get it, they just don't understand, and they just like to stir the pot. And stirring the pot for us has been really, it's just hurtful, it's tiring. We are working so hard and harder than we ever have to meet the need, and handling and dealing with that kind of stuff is just making it harder. And food insecurity is a nonpartisan issue. It is just not one party or the other that we're seeing, and that's one question we don't ask when somebody comes to receive assistance. We don't say, hey, who'd you vote for?
So my second part to that is, for those that are worrying about folks gaming the system, using the system, when you call them, obviously that's one way, but are there some other ways that you are working to rebuild trust with those folks who may hear that narrative and be like, well, obviously something's wrong, they don't need my support? Mm-hmm. How are you gaining that trust back?
We've changed our messaging to our donor base. Mm-hmm. We've been proactive in addressing some of the things. We if you go to our website right now, and that's probably the biggest thing that we've done, is made it very clear and very transparent, who's coming to us for food, how they can get food, and what we need. We've also, welcomed opportunities like this. So one-on-one conversations is great. Anytime that we can be with someone like you that's asking these hard questions, bring the hard questions. And I think if that's a message that anybody needs to take away, is we'll answer anything. Right. We're not trying to hide anything.
Right. Some critics argue that food pantries are enabling dependency rather than encouraging self-sufficiency. We had talked about this before the cameras started rolling, and I really, really liked your response, and I think it was powerful. Can you tell the viewers how you responded to that?
Absolutely. So we have a lot of programs at the food bank, and I'll say this 10 times today. Come visit us. Come visit us. Walk with me through one of our facilities for an hour and see everything that we do. But we call it Food for Today and Food for Tomorrow. Our Food for Today programs are exactly what we've been talking about, getting food out, all the different ways that we provide food. We provide, backpacks to children very discreetly in their back, and a little bag goes into their backpack and goes home with them so that they can eat over the weekend. The thought that a child doesn't eat if they're not in school is simply heartbreaking. So we have a lot of ways that we get food out. Our Food for Tomorrow programs are all designed to help people not need to come to us for food. So we have workforce development training, with culinary training. People get trained in logistics and operations and warehouse. We have special training programs specifically for people with intellectual disabilities to be able to get jobs and get meaningful work in the community. We do financial coaching. So if somebody's coming to us for months on end for food, we hook them up with one of our Stand By Me financial coaches to help them budget. Lots of people didn't learn that. Go through school and you never learn how to even balance your checkbook. So we help people with that. We help them with nutrition education. We help them access benefits if they didn't know how to get SNAP or WIC. So we do a lot of things in that space as well, and that's all designed to help somebody not need us in the future. And while they're getting those skills and gaining those skills, I hope and pray that they're also getting the help that they need today, because it all goes together.
So a couple more tough ones for you, I apologize.
Bring it.
I want to go into transparency about financials and public trust. So some critics online, a lot of Facebook warriors, keyboard warriors, or what I call them, are pointing to your most financial reports. And they're saying the Food Bank of Delaware ended last year, 2024, with over $56 million in net assets, as well as a surplus of nearly $10 million. How do you explain needing emergency help from the public and the government when your financials show some stability?
Yep. So I understand how that can be confusing for people, so I thank you for letting us explain it. Those net assets include our 2 buildings, include our farm equipment and our warehouse equipment. They include our trucks and our vans that get the food to people, and they include our food. So we have, food banks have to put a value to the food that they have in inventory. And so for us, there's a calculated, it's $1.97 a pound, and that turns into the food that we have on hand at any given time. And so that's all included on our financials as part of our those net assets. And I don't think people realize that. That is not that amount of money sitting in the bank waiting for us to maybe never spend it. It just isn't. And if people don't understand that, I think a really clear and easy way is to say, we can't pay the bills with a can of corn or a box of cereal.
On that note, there's skepticism that food pantries and food banks, like what we have here in Delaware, are exaggerating this crisis from the administration for political or financial gain. What do you say to those who believe that this is being used to attack one political party or another?
So I think we've talked about this a little bit already. We don't, that makes me sad to even have to answer that question, because again, we don't see the world politically. We just don't. The people that come to us are from all walks of life, and the people that work for the food bank are all walks of life. And we're all here because we realize that food insecurity in our country and in our state is a problem, and it's been a problem for years. It didn't just start in January or in November, however you want to talk about when we got into a different kind of political climate. It's been how we've operated for years, and I take pride in the fact that we're nonpartisan. So to spin it that we're using this to get some kind of financial gain by pointing the finger, I say no. I say no, that's not the case.
The food bank receives, as we said, tens of millions of dollars in public and private funding each year. How do you ensure that that money is being spent effectively and efficiently and in the most transparent way possible?
Sure, and we are transparent is a great word. We are very transparent. We put our financials on our website. All of our programs are on our website. We get a lot of federal funding that comes through the state, or just comes directly to us to operate the programs that we operate. So all of the SNAP and WIC and TFAP and TANF and all those different ways that we get funding are all the ways that we then push out the food and services that we're providing. And so I don't know what else I can answer that. Do you want me to keep going there?
No. That definitely answers it. I appreciate it. And I will say, in the preparation that I've done for this interview over the past couple of days, I went on your website to see if I could find your financials, and they were incredibly easy to find.
Yeah.
And so you're not hiding anything, they're right there.
Right. But to your point, I mean, I think some of it's hard to understand. So that the net asset question, we've been getting that a lot, because yes, our financials are there, but that's maybe not, if you're not used to looking at food bank financials, you don't get that. It's pretty rare, I think, to have such a huge part of your net assets be food or be a product, and some people just don't understand that. So again, ask the questions instead of making assumptions. Ask the questions.
Gotcha. We're going to turn the heat down now a little bit. So I want to talk about you personally, if we can, to learn more about sort of the face behind the head of the food bank. So you've spoken publicly, and I've seen you speak many, many times. You've spoken candidly about your personal journey, about the unpredictability of life and caring for your own children. How does that experience in your home, your household, your journey in life shape the way that you lead and connect with families that come to your organization for help?
Thank you for asking that. And I do believe, and I'm careful to say this and not couch it, and not everybody believes this, but I believe that everything happens for a reason. And I believe that my husband and I were given our twin sons, Sam and Adam, and our third son, Stephen, for a very specific reason. Sam and Adam were born 4 months early. They're 33 years old now. And they were born basically clinging to life. And I worked the day before. My husband and I were, not newlyweds, but we were young and had been married just about a year, and found out we were going to expect twins. And when you're at that stage of your life, it's all exciting, right? And you're thinking about names, and you're thinking about, is it going to be a boy or a girl or one of each? You're not thinking about, are they going to be born at 1.5 pounds each and start their life off in a NICU? So from day one, we have had challenges that have been thrown at us, and we've conquered each one, and we've conquered each one sometimes, you know, with a lot of tears and other times with a lot of anger, but we've gotten through a lot. And so thinking back honestly in those early days, we had to charge diapers. And I bet you if we didn't have the safety net of our families, we would have been in those lines. And that was hard, like something for me to kind of realize as I got into this work. People don't realize what the gifts and the safety net sometimes that you have if you have it. It's easy to not know until you don't have it. So my journey took me from raising 3 little boys under the age of 2. We had 3 babies, and I stayed at home. I was told that, you know, we were told, I should say, that if we put the babies in a daycare or any kind of a daycare setting, that they probably wouldn't survive. They were so medically fragile. So I left my job, and I was stayed at home, and we cut that salary income that we had in half. And let me just say, neither one of us were making a whole lot of money in those days. So 3 years, you know, as we got through time, at 3 years old, the boys were both not developing typically, and we realized that they were going to need special care in terms of education and daycare, and our younger son was only learning from them. So when they were 3, we put them in a special needs preschool, and Stephen went to daycare, and that's when I went back to work. And the first place I went to work was the March of Dimes. So the March of Dimes for me, certainly the March of Dimes mission is healthy babies and healthy pregnancies, and it just matched our life and stayed there for 13 years. The twins were both diagnosed with autism when they were 5. I then went, you know, my next stop along my career was with Autism Speaks nationally. And then my last 5 years before the food bank, I worked here locally at Nemours A.I. DuPont Hospital for Children, all very closely tied to my heart and to my mission in life, and really kind of created the values and the drive that I have and the purpose that I need. And to transfer that to the food bank has been seamless. And again, I point out, and I won't use his name because I embarrass him when I do, but the one person that helped me see that really made a difference in not just my life, but I like to say in a lot of people's lives, because I think that what I bring to the table is exactly what you just said. I help people see how that maybe could be them. And I think that's sad that it needs to be done, but it's a definite reality.
So I want to wrap this up with a few final questions here. You have an amazing team. I've been able to visit your facility, both facilities, and there's not one person at your team that isn't just so gracious and so hospitable and so kind, no matter what you're going in for. If it's a tour or hear you speak, whatever it may be. So I wanted to ask, in moments of uncertainty like this that the food bank is facing, where do you and that team that you lead find motivation and resilience to show up every day?
So I like to steal other people's words. Why recreate the wheel? But I actually heard someone say, instead of saying I have to go to work, I get to go to work. And it just, for me, kind of flipped. A lot of times when times are really hard, you don't know if you can keep going. And for me and for our team, that's what we say now. We say we get to do this work, and there are people that aren't up for the challenge. So just recently I sat with we call it our organizational alignment team. It's all of our directors level folks. And I shared that, you know, that's the mentality that we have to have, especially right now. And if they or someone that reports to them doesn't have that, this is the time that they need to maybe choose something else. We're not begging people to stay. We're expecting people to stay with the right attitude. And that is an honor and a privilege to be able to wake up every day and in this crazy world that we're living in, find purpose and find a way that we can actually serve.
Speaking of serving, we are fortunate enough to have an audience throughout the state in all 3 counties. And they're watching this today, and my thoughts are that they are at home or on their tablets or phones, wherever they're watching, and their question is, how can I help? I may not have the means to help financially. how can I help and make good? What are some options that people can do?
Sure. So for a little bit of context, when people don't think they have the means to give financially, $1 equals 3 meals. So, you know, and I love when a child comes in with a piggy bank and thinks that, you know, because that child is learning already, and we can tell them how many meals that their little piggy bank represents. Go on our website, fbd.org, and the first thing you're going to see, because that's what's happening right now, is the urgent need that we have. So it is financially, but if you don't have those means, and it doesn't mean that's a huge check. I mean, we wish I had the numbers off the top of my head. I want to say it's 57 new recurring donors that just since this all happened, that means somebody's gone online and they say, hit me every month. Wow. And we can make that happen. So they might give up the Friday night pizza. And that matters. Every dollar matters right now. Food drives also matter. So if people are in, you know, I've talked to several of our elected officials throughout the state are having their departments do food drives. You know, that helps. It helps to go online and just say, hey, the food bank's doing really good work. And here's a link. Help us spread the good and help us meet the need, and don't kind of perpetuate the rest.
Right. Love that. Lots of ways that people can help they may not realize, right?
Yeah.
If you could snap your fingers and get one policy change or community commitment, what would it be? Sustainable
support, and whether that's getting into the state budget or making sure, it's tiring to constantly have to make your case year after year after year. And I had someone in a state position early in my stay here, let's say my career, but my career is beyond the food bank, say you're part of the state's infrastructure. And so if we're part of the state's infrastructure, help us feel that way. And I think that would be that, because honestly, I think that we need to, so I'll agree with a little bit of the naysayer, we need to not be so reliant on federal funding. We need to be not so, but that's the food bank model. So we can't overnight, we just can't overnight make that change, but help us figure out how to get sustainable support so that we don't see people not being able to get the food they need.
Before we let you go, I wanted to know if there was anything we left out on the table today, any message that you want to give the viewers, anything at all before we wrap up.
I would like to add a little bit about what you asked about myself personally. We are also at the food bank. We know, so we live it. We live with two young men who are, you know, beautiful human beings who happen to have autism and have a harder time at life. And we have seen friends not be able to figure out how they can be serving a meaningful role in life. The programs that we've added for people with intellectual disabilities, I want people to know about them too, and we talked about the training. We're going to be adding more to that kind of cadre of services. People with disabilities are more than twice as likely to be unemployed, and then more than twice as likely to be food insecure. So that's another area I just want to make sure people are aware of, because what's happening in our world, which I just love, is we're building awareness on both sides. So it's you know, our culinary training and our kitchen school training, which is culinary training is happening at the same time in the kitchen with the same people, and they're seeing each other. And we graduated 2 classes this week of the kitchen school, and what I saw looking at the students who were in our traditional culinary program was understanding, acceptance, and when they are in a restaurant someday and somebody gets hired with a disability and walks in, they're going to know. And so the ripple effects of a lot of what we do are the hard things to describe, but I will just once again involve anybody that wants to see and hear what we do. Please, please, please reach out, and I'd be happy to give you a tour and talk to you about what we do.
That's wonderful. Thank you so much for being here, Cathy. We
Absolutely.
really appreciate it.
Thank you.
You'll come back. Thank you. Our thanks to Cathy Kanefsky for her time and her transparency today. Whether you're someone who relies on food assistance, someone who donates, or someone who simply wants answers, This conversation is part of a larger dialogue about how we care for one another in times of need. For more information on how to donate or volunteer or get help yourself, visit fbd.org. We'll, of course, continue to follow this story and others affecting families across our state right here on DETV News. For all of us here at DETV, we'll see you next time. Good night.